Many people are amazed when they meet someone who has hearing loss or believe that becoming deaf cannot happen to them. But it is more common than one may think. Do you get frequent ear infections? Love loud music? Are you older or have you noticed a loss of hearing? Do you take a lot of prescription over-the-counter drugs? Or do you know anyone that was born deaf or became deaf as a child? If you know someone who any of this has applied to, or if any of these apply to you yourself, then you are at risk or have experienced cochlear damage. According to the National Institute of Health, approximately 36 million American adults have some degree of hearing loss, and two or three out of every 1,000 children are born deaf or hard of hearing. KidsHealth.org says that because of those statistics, hearing impairments is the most common birth defect. As a mother of a deaf child who now has cochlear implants, I have done a lot of research on cochlear damage. Cochlear damage does not have a type. It can happen to anyone, but is sometimes preventable. Today, I'm going to be informing you on how the ear works, what is cochlear damage, how it is diagnosed, and how it can be prevented or treated. The ear is made up of three parts: the outer ear, the middle ear, and the inner ear. The outer ear consists of the pinna, which is the part that you could see on the outside, the ear canal and the eardrum. The sound travels down the ear canal, hitting the eardrum and causes vibration. The middle ear, which is behind the eardrum, consists of the ossicles, which are three teeny bones that are connected to the eardrum on one end and the opening of the inner ear on the other end. When the eardrum vibrates, it causes the ossicles to vibrate, and that in turn causes the fluid in the inner ear to move. The inner ear consists of the cochlea, the auditory hearing nerve, and connects to the brain. When fluid in the cochlea begins to move, it causes changes to the hair cells. The movement of these hair cells send electrical signals from the inner ear to the auditory nerve, then to the brain. These electrical signals are interpreted by the brain as sound. The ear is a complex system, and when something is not working properly, it affects the overall function, which is hearing. Sensorineural hearing loss occurs when there is damage to the cochlea. This is the most common type of permanent hearing loss, which is prevalent in 90% of cases. Cochlear damage can be caused by a lot of different things. The biggest factor is genetics. Others are age. 1 out of 7 people over 65 experience hearing loss. Meniere's disease, which is a buildup of fluid in the ear infection, head trauma, ear surgery, malformation of the inner ear, meningitis, ototoxic drugs, loud noises, and acoustic neuroma, which is a benign tumor. There are also unknown cases. Loud noise is a cause of sensorineural hearing loss, which you'll hear me refer to as SNHL, and is oftentimes preventable. The noise-induced hearing loss can happen because the noise-induced hearing loss happens because the vibrations damage the hair cells. The effects of loud noise can be temporary or permanent. Noises in excess of 120 to 150 decibels put you at risk for SNHL. Some examples of these are motorcycles, fireworks, firearms, lawnmowers, and jets. HearingLink.org states government research has found that repeated exposure to noises that are 85 decibels, such as heavy city traffic, can also cause sensorineural hearing loss. Symptoms are failure to respond to sounds, speech delays or lack of speech, hearing nothing at all, or if sounds are heard, they are quieter, distorted, and less clear. High tones are less audible. S, I, and Z are not heard and there's difficulty with hearing speech with background noise. Tinnitus and vertigo also are possible symptoms. A person can usually tell if there has been a change in their hearing. But to get more in depth on the extent, it's important to go to an audiologist who can check your hearing. To diagnose hearing loss, an audiologist tests your hearing using one or more techniques. If hearing loss is detected, options are available. American Speech Language Hearing Association, ASHA.org, lists 5 different methods. The methods are based upon the age of the person and individual factors. Some of the tests that audiologists use to diagnose hearing loss is the auditory brainstem response, which they refer to as ABR. This test detects the brain's response to sounds. Autoacoustic emissions, which they refer to as OAE, test the inner ear response to sounds, and the behavioral auditory evaluation tests the overall function of the ear by monitoring a person's behaviors and reactions to sound. In the event that there is some hearing loss detected, then a patient can be provided some options according to their individual case. In sensorial hearing loss cases, the possible treatments are often hearing aids or cochlear implants. This is a hearing aid, and this is a cochlear implant. A hearing aid amplifies sound to pass through the ear so the brain can receive the sound signals. When hearing aids do not provide enough for hearing, cochlear implants are the second option. Cochlear implants bypass the damaged hair cells and turn sound into electrical impulses to stimulate the auditory nerve directly. The cochlear implants consist of 2 components. One goes on the outside, which is what I showed you before, and one goes on the inside of the ear, which requires surgery. And this is the device that goes on the inside. This is the magnetic piece, which the coil attaches to, and that's the coil. And then this is a piece that they stick into the cochlea. As you can see, it has the same design as the cochlea in an ear. You are not well informed on cochlea damage. Today I went over how the ear works, cochlea damage, symptoms of cochlea damage, and how it can be diagnosed and treatment options. My hopes is that from this presentation you have all gained a greater appreciation for your hearing. It is not to be taken for granted. Please remember that hearing loss caused by noise exposure can be permanent, but is also preventable. So next time you want to blast that loud music, think about what you're doing to your hearing. And if you're around loud noises, invest in your ears by buying earplugs. Thank you all.